Hello everyone, I'm Dr. Aditya Sai. Welcome to our channel Shoulder and Knee Clinic, where we discuss various aspects of shoulder and knee injuries, the treatment, and how you can avoid them. So, you would have heard about an ACL surgery, you would have heard that some athletes have undergone it, and obviously, you would have listened to some people who have had not such good results with an ACL surgery. So, in this video today, we will discuss why sometimes an ACL surgery doesn't work out. What are the causes of failure of an ACL surgery? So we have already discussed about what an ACL surgery is when it is done. So there are separate videos for that, and I'm not going to dwell that too much. But essentially, in an ACL surgery, the ligament is reconstructed, and that gives stability to your knee joint and prevents injury to any other structures in your knee. Now, when we talk about ACL surgery, essentially it's not a bulletproof thing. So if you injure your knee in a way that a normal knee can get injured, obviously your operated leg also can get injured. Although the graft we put inside is very strong, and we do a lot of rehab after the surgery, but still there is a risk of a re-injury. So what are the factors predisposing you to a re-injury post an ACL surgery, or why certain people are not satisfied with it? So we need to identify who are the people who are at risk for failure post an ACL surgery. So one is individuals who have very lax joints. Obviously, in the whole population, if you see, even in your family, if you see somebody may be able to touch the thumb at the back of the forearm, somebody may not be able to do a lot. So some people are stiff jointed, some people are lax jointed. So there are criteria for lax jointed individuals called the Baton criteria. Individuals who have very lax joints, they are at a risk of re-injury post an ACL surgery. Second thing is people who have already undergone an ACL surgery and it has not worked out for them, obviously they are at a risk of re-injury. Women, they are at a risk of re-injury because their biomechanics, the leg, are different from men. Generally, the quadriceps have a higher tone compared to the hamstrings. The way the bone is shaped, so especially in this area which is called the femoral notch, the bone is narrower in females, which can predispose them to a re-injury. Then obviously there are individuals who play in contact sports, individuals who are less than 20 years of age in their index surgery. These are all the people who are at a risk of injury post an ACL reconstruction and a recurrence. So in addition to this, in addition to the failures of an ACL reconstruction, there are certain scenarios where people are not happy after an ACL surgery. Like you might have heard somebody say that I did my ACL surgery 1 year back, but I never feel normal. There would be some individuals who feel that things have not worked out and they are not able to play sports. So what are the reasons for that? The leading reason for that is improper rehab. So a lot of times once people start walking, especially youngsters, they feel that their knee is recovered and they don't undergo further rehab. So it's very important that they follow the proper rehab protocol, which typically takes around 4 to 5 months for you to return to sports. So it's very important to follow that. If you don't do the full rehab, generally the chances are you'll never be happy with the surgery.